Hi everyone, my name is Annie Linville. I'm a pelvic floor physical therapist, and today we're going to be going through an 8-minute pelvic floor mobility workout. The only piece of equipment that you'll need is a yoga block. We're going to be doing positions that help prep the pelvis for birth. So positions and movements that open up the top part of the pelvis called the pelvic inlet. We're going to be doing positions that help open up the midpelvis through asymmetry, which is that middle part of the pelvis. And then we'll also be doing positions that help open up this bottom part of the pelvis, also known as the pelvic outlet. So go ahead and grab your block, kick off those shoes so that your feet can really connect with the floor, and let's go ahead and get started. All right, to start off, we're gonna go ahead and get into a deep squat. So ideally, we're allowing those hips to really drop in between the knees. You're trying to get your feet flat onto the floor. And you wanna make sure that the big toe, the little toe, and the heel are staying down. You're really shifting and relaxing into this position. So we're gonna be just shifting our weight side to side, and you wanna be kind of giving a gentle stretch outwards into those inner thighs with your elbow as you shift your weight back and forth. We're taking nice deep breaths in through the nose and allowing our pelvic floor, the muscles around the vagina and the anus, to lengthen and relax. You want to think about this as being, as those knees are in external rotation, this is going to be promoting a widening and an opening at that top rim of the pelvis, so AKA the pelvic inlet, which is usually when the baby needs space at the beginning of labor. So this is going to be a great stretch and position to be in to help open up that top rim. Shifting back and forth. Perfect. Okay, let's go ahead and shift into our next movement. You're going to be taking a 90-90 position where one foot is going to be at 90 degrees, or one hip here in the front in external rotation. Other leg will be back into internal rotation. From here, you're going to reach forward, hinging at that hip, really feeling the stretch in the back side of that hip. Hold it for a few seconds, and then you're going to reach back and stretch through that side body, really lengthening and allowing this hip to kind of stretch gently into internal rotation. Holding for a few seconds, and you're going to reach, go to external rotation again, feeling the stretch on the back side of this front leg. And then other side. We're breathing, we're not clenching anything. In through the nose, out through the mouth. Keep checking in, making sure that the muscles in the pelvic floor are nice and loose, not clenching. And this is a position that helps prep the pelvis for some asymmetry. That mid-pelvis is opened where one side of the body is doing something different than the other side, which is gonna help create space for the baby to rotate. We're gonna switch sides, so just go ahead and prop. Other side into external rotation, back leg into internal, keeping those shins at about 90 degrees. We're gonna reach for that external, and then reach and shift, get my timer reset, into a side body stretch. Reach, feeling a stretch along the back side of this hip. Internal, reaching towards one side, and it's not uncommon that one side will feel a little bit more restricted than the other side. Internal rotation, this position is not as available to people as external rotation is, especially in pregnancy. A lot of women tend to favor that like turned out position where their feet want to turn out just naturally as pregnancy posture progresses. So internal rotation and finding the full range of motion is super important, especially as we kind of prep for birth. We only have a couple more reps. Inhale. Exhale. Inhale. Good, perfect. Okay, now let's go ahead and set up. We're gonna go into an adductor rock back where you're gonna be on all fours. You're gonna extend one foot out to the side, and you'll be almost in that quadruped position, but with that one leg extended. And you're going to send those hips back towards your heels, feeling that stretch increase along the inner thigh or the adductor muscle. And then you're gonna come back up. Easy stretch back, feeling that stretch along the inner thigh. This should feel good. If you struggle with pubic symphysis pain at all, make sure that this stretch is just a little bit easy. We're not being super aggressive with it. Nice, easy stretch along the inside of the thigh. I have people kind of aim to keep their foot down rather than just letting it roll up like this. It helps keep some tension along the inside of the leg. And so again, this is another movement that, one, we're just decreasing tension of the muscles around the pelvis, but also great for the mid-pelvis because one leg is doing something different than the other leg. So we're opening up one side as we kind of close down the other, creating space for baby to rotate down. We're gonna go ahead and switch it up. So I'm gonna scooch to the other side of my mat, extend one leg out to the side. Same exact thing, we're shifting back, feeling the stretch along the inner thigh. Making sure you're breathing, making sure that the muscles in the pelvic floor, so again, the muscles that are around the vagina and around the anus, we're trying to avoid holding those in a clenched position. It's just not necessary here. And we're just really focusing on honing in on our breath, inhaling and finding expansion through the rib cage, exhaling and shifting that weight back. Good, a couple more reps. Okay, great. All right, so now we are going to go ahead and grab our yoga blocks. We're gonna go into a hip shift pelvic tilt. This is a great movement for prepping the pelvis for birth. This is one of my favorites and most prescribed movements as a PT. You're gonna put the block under one knee, and that's gonna drive your femur back into this part of the pelvis. You're gonna be on all fours and you're gonna shift your weight so that all of your weight is in through the leg that's on the block, and so that you feel this stretch happening in the back side of the pelvis. And from here, we're gonna allow the body to go into a cow, so we're doing cat-cow or a pelvic tilt, and then we're gonna come off of it. We want to inhale and expand, picture those sit bones spreading. Again, most of my weight is through this leg on the block. And then exhale, come off of it into that tilt. Inhale, spread the sit bones. Exhale, come off. Great, last one. And then just switch sides. Under the other side, you're gonna shift your weight into that side that's on the block to feel that back side of the pelvis opening. You'll just feel like an expansion happening there. Keeping the weight through there, you're gonna go into that tilt. Exhale, come off of it. Again, it's not abnormal or it's not uncommon that people will feel that one side is a little easier for them to access, or that one side is just a little bit more pinchy and a little harder to feel. And that's totally normal. And what we would want to do with that is pay attention to that feedback, and maybe we spend a little bit more time opening that space. For me, this side feels a little tighter. Inhale, expand. Exhale, come off. Make sure that weight is still shifted into that block. Great, okay, last one, we're gonna end. We're doing a child's pose with hip internal rotation rock back. So you're gonna be on your hands and knees. Internal rotation, remember, is difficult for people to find a little bit more. So you wanna have those ankles wider than your knees. And you're gonna shift back as far as you have able into a child's pose. So just heels towards your butt, and then you're gonna come back up. Now this one and that last movement with the hip shift are helping promote internal rotation, which is opening up that bottom part of the pelvis or the outlet. And this is the area, this is the movement that most people have trouble with. Again, most pregnant women have more ease finding external rotation. And so internal rotation feels weird for them. As we come back, we may even feel a little pinchiness, and that is something that you can just kind of meet where your body is. Focus on spreading those sit bones as you shift your weight back, and then come right back up. You may not be able to go all the way back, and that's totally fine. We're just focusing on here, finding expansion, inhaling, and exhaling as we come back up. One more rep. Good. Exhale, come back up. So this is one that you can be doing throughout your pregnancy. You can really focus on these movements when it comes to the third trimester, with the goal of prepping for birth and labor. Let me know in the comments how you liked it.